always choose when it's necessary, because it's actually quite destructive using the facial block, although it's actually, when you know the technique, it's very safe. But always use accordingly. If you think that it's actually enough with MLA, go ahead with MLA. Tak payahlah nak adventurous using the facial block. Of course, facial block good because of longer pain relief. Depend on the agent. You put bupivacaine, then you put a long acting, then it become longer for 6 hours. You got short acting, it's actually shorter. In fact, MLA is actually quite long, no? The coverage. For so far that post-operatively, I would say that around 1 hour, something like that, still painless. Okay, always need to know just the anatomy of it. Okay, I said earlier on 7. You got auriculotemporal. This is from the great auricular nerve. Okay, so you got facial, you got mental, and then you got infraorbital, you got supratrochlear, supraorbital. 1, 2, 3, 4, 5, 6, 7. 7 spots that you need to actually block your face. Both sides. It's just that there is some time you go into your columella, there is a usually small ethmoid branch of the it's still infraorbital, ophthalmic, something like that. So nose is actually got another series lah. So that's the only thing that you need to block. 7 big trunk lah. You go on the nerve end, then it's a bit more. Okay, so this is how it goes. You got ophthalmic, you got the maxillary, and then you got the mandibular. By logic, kalau you go and block this trunk, then you will actually block all lah. The problem is you go block this one, is going to be very deep and very close to that sinus. So you takut masuk dalam tu lah. And it has to be very specific and a very small window of error, but compared to you go on the distal part. You just need to know the directions of the nerve and how they actually came out from the certain foramen. So you go towards that wall of foramen, then it will be very safe. Be protected by the bone, and bone is quite thick. So you feel you hit the bone. Of course, you go slowly, kan? So even the medial wall, upper orbital wall, thin bone also you cannot go through. So it's quite safe. Right, this is a repeat. Okay, so this is 3 parts. When you want to block the middle face, you just need to actually supraorbital, supratrochlear, and infratrochlear, infraorbital, and mental. Okay, right, that is middle face. I said earlier on, you got that sometimes kind of ethmoid nerve end is come up into your base or your columella. So you can actually always put some 1 cc there lah. So the way always easily palpable. This area is quite thin. The skin is quite thin. You can actually palpate the notch, the infraorbital notch. Just go below it because it actually come up, and put the needle, draw, and then go give 1 to 2 mil. The problem with sometimes we're actually afraid to give more because it will swell. Don't worry, it will swell as long as you don't hit the vessel. It will swell just for that time. You just do a massage, it will deflate already. So it's been absorbed very fast. When it says 1 lah. In certain area you need 2. For example, this loose area, mental nerve, you actually give a bit more. Because it's actually very loose area. So that's why it doesn't cover. And then they got small branch very fast when they came out of the foramen. So you need extra amount to actually cover quite big area, right? Infraorbital, you need 1 to 2 or so because it's actually quite big nerve trunk. So sometimes they actually spark very fast, very far. So that's why you need to be a bit more. Supratrochlear, supraorbital, very small nerve, very one straightforward. So maybe 1 mil is actually enough, right? Diagrammatically, that's why. So zygomatic-facial is actually at the reflections of the lateral orbital wall and the upper temporal. So it's actually something like a crater there. So it's always safe for you to go, as long as you don't go anterior to your upper lateral orbital, then you're safe. There is actually a crater there. So we never go through your eye. So hit that, draw a bit, and then inject. Here, macam supraorbital, you direct your needle upward and laterally. So you will never come to your this one. The infraorbital nerve, don't worry, because the gap between the orbital margin to that foramen is quite far, 1 to 2 centimeter. Kalau you ganas sangat masuk all the way, yalah, you can go. Just that be careful with children. So children always direct that way, from lateral. Because you go that way, children sometimes they flex their head when you actually give the local. So you can accidentally pass through the orbital when they actually flex their head. Okay, facial block. Right? Now for the hand, this is very, now the hand of aesthetic treatment of hand is become very popular now, because of the reason I said earlier on. It has to be comparable in terms of the use of the face, of the body, and the hand. And hand is actually the exposed area as well. So you might do a fractional CO2 for hand, for example. Filler for hand. Certain person want fullness of the tina, for example. That is actually quite prominent when you have you got a full shiny face, but you got hollow tina. Some of them want the filler, for example, here, there. And this area we are talking about palm is very painful. So you need to control the pain first. The simple is actually you can actually do a wrist block. So wrist, you got you need to block the radial nerve, you need to block the ulnar nerve, and then the median nerve. So for radial nerve, you actually have to locate the radial styloid. Inject 5mm LA subcutaneously, immediate proximal to radial styloid, first medially over the wrist crease. Okay, understand that? You can take this lecture, no, don't worry. And what I want you to actually take note is, see, 5 mil. Usually when you are actually new, you're very afraid to actually give that amount. The small area, but imagine you give 5 mil.